Let's bring him in. You know, he is right here, Wednesdays, 8:35. Our good friend, Dr. Joe Congini, on board with us. Good morning, Dr. Joe. What do you have for us today?
Hey, Ray. I get myself in trouble sometimes. I go out into the week. I'm going to try a topic today that's a toughie, but it's kind of ties together football, which we were all excited is starting this week in high school and college right around the corner and pro. And this injury occurs in football and contact sports, but it also occurs a lot in baseball as they come down the stretch. And I read that just such frustrating story about another one of our great Guardian prospects. I know you've done a great job highlighting the Guardians this week, Ray. Thank you for that. But it seems like so many of our prospects, we've just gone through a stretch of so many injuries, and our can't-miss pitching prospect, Daniel Espino, we're going on 3 years that he hasn't been able to pitch. And he had a big surgery last year, and he just hasn't come back from it yet. And this was a true can't-miss pitching prospect. And so this injury is known as shoulder instability, Ray. And in the sport of football, for us and taking care of football players, it's probably number 2 or 3 most common injury we see. And it's very common in baseball pitchers, tennis players, volleyball players that are overhead, but for totally different reasons. And that's what makes sports medicine kind of fun. The mechanisms are different in different sports. And so shoulder instability means the shoulder gets stretched out and loose. And if it's stretched out and loose, you can't throw a baseball fast, and you can't make it spin, and you can't tackle people, and you can't block people very well. And so shoulder instability is a really tough problem that we face. But we face it for these 2 different reasons. And so I want people to understand when they talk about Espino's surgery, he went out and saw one of the world's experts out in L.A. for the second surgery, and he repaired what's called the capsule, the anterior capsule. And when people hear that in the shoulder, oh, my gosh, we've heard of labrum, we've heard of rotator cuff. What's the capsule? The capsule's really important. The capsule is this strong, tough ligament that holds the ball on the golf tee or the ball in the socket. If you see an X-ray of the shoulder, it just looks like a ball sitting on a small golf tee. And so what holds it there through all the rigors of sport is a really tough, strong ligament. And so what happens is this ligament through sport, either through trauma like in football or contact sports, or from repetitive throwing and overhead activity, gets stretched and torn. And then we usually, especially in our high school kids, start with physical therapy. And we do a pretty good job in getting many kids back with physical therapy, unless they had a really bad dislocation where that ball popped all the way out. Many of those need surgery, even in our high school kids. But rehab is the first treatment, and we try to get that shoulder strong. This is different than the labrum. People get mixed up between the capsule, this tough ligament, and the labrum. The labrum is a cartilage rim that helps make that socket a little bit deeper and also hold the ball in the socket. And when the labrum tears, it also can lead to this shoulder instability or shoulder slipping out or shoulder flat out popping out, dislocating. And when you do those things, it's just very difficult to play sports. So really unique in the mechanisms of sport. And so, again, with our pitchers, it's more the overuse and the, trying to get as much velocity and spin rate. It's really a unique mechanic. One of the cool things about being in a career of sports medicine, the mechanics of all these different sports and even different positions in sports really affect the injury a lot. So we get into a lot with our young athletes about what's the mechanism of how this injury happened versus somebody who fell on the shoulder or in a sport like football has the shoulder pulled back, hyperextended and pops out of place. And that is also instability of the shoulder. That is also an injury and damage to this capsule. And if the damage is bad enough, then we start talking about surgery. It's really kind of interesting. The ones that stretch it out through overuse, like pitchers and tennis players and volleyball players, they're a lot more likely to do well with physical therapy and be able to get back to their sport. But those that pop it out in contact sports, there's a lot more chance that it's going to pop out again, and we start talking to our surgical friends pretty early about tightening it up. And they do better because often that capsule tear is only in one particular small part of the capsule. The capsule has an upper part, a middle part, and a lower part. It's a big, thick capsule. So they're very different. And I've had a career of working with pitchers, and they particularly are a sport and a position that's been very difficult, and I think even gotten more difficult as the last 20 or 30 years have gone by. I was looking back this morning, I wrote a position statement for the American Academy of Pediatrics in 2012 for pediatricians and other people that take care of young athletes about how to try to prevent injuries in pitchers, and it's so outdated nowadays. It's so far down the road that we move pretty quickly down the road into different things. So this is an injury that can occur in both groups for different reasons, and I just wanted people to be aware of that. Ball and socket staying in place is very important in sports that are contact sports, as well as sports that are overhead sports.
Joe, you opened up in talking about Espino, who's unfortunately, and you mentioned it, has been hit with injury after injury after injury. Some of this stuff's certainly genetics, right? But some of it also, I wanted to ask you from a sports medicine standpoint, that if we get the injury in one place and we're a pitcher, does the body compensate in another place that could lead down the road to, say, another injury, and then that compensation could possibly lead to another one? Do you see any of that pile-up type of effect with injuries in sports medicine?
You and I have talked about this a lot, and I wonder, Ray, do you stay up till like 2 or 3 in the morning reading articles about sports? Because I read the same thing, and I wondered, his first injury really was a knee injury, and he maybe never got over the knee injury, and then he had the shoulder instability, and then he had the first surgery, and that's a bad sign in a pitcher, and then he had the second surgery where he went out to see really kind of the world's expert in Los Angeles. And yet they thought maybe in early 2025 this year, he was going to climb the ladder of AAA and everything. Hey, we're in late August now, mid to late August. It doesn't look very good for this year. That's 3 full years. He hasn't pitched in a game since 2022. And I definitely do believe exactly what you said. You and I have talked about this, is injuries do roll one into another. And I wonder how bad with that knee injury, if it didn't respond totally, he may have changed his mechanics some. Mechanics in pitching is so unique, Ray, right? You love baseball, but like no other position in any other sport that I got to deal with, in my career in sports medicine, pitching and throwing a baseball is a really unique mechanism, and it's hard to find good pitchers, and it's getting even harder in this day and age of spin rates and velocity and things like that. So it's a thing that we're not doing that well with, and I definitely am suspicious the knee injury had something to do with the shoulder problem.
Yeah, and you can take that to the next step, whether it be a minor leaguer or a major league or even someone in high school, the will to win, the will to be out on the mound, sometimes trying to pitch through difficulties, one for the dollars on the pro level, but one for these kids wanting to stay on the mound. Unfortunately, sometimes that may add up to future difficulties, especially as Joe mentioned with pitching. So my point is if you're starting to feel discomfort, no one knows your body better than you. Get it looked at by sports medicine before it could possibly be a hindrance on down the road in certainly baseball or whatever sport we're talking about.
And even be on programs in the off season for prevention to tighten the muscles around that capsule and shoulder. Those kinds of things work. But I'm afraid there's so few people that can do the mechanism of pitching. We have less and less pitchers, and the burden falls on even more pitchers. So you are exactly right as usual. You could be giving these lectures yourself, but thanks. You do a great job, and I really enjoy getting a chance to chat with you about it.
Always enjoy our visits, Joe. We'll do it again next week. Thanks for the time, my friend.
Okay, sounds good, Ray. Talk to you later.
You got it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us this morning.